And I would advise everybody, like, I just remember my own personal experience. Like, when I got to med school, they only gave us one free book. And that free book was the Merck manual. We, of course, sponsored by Merck, right? The pharmaceutical giant. And had every disease in a drug, you know. And I was excited because I got a free book because, I mean, man, all the books are so expensive, you know. And but it was just the amount of medication and indoctrination in what is considered modern medicine is very high. And then if there's anything that essentially is not medication by big pharma, there's never enough studies to support it because the studies cost so much.
Right.
So even if you had the cure for cancer, you know, with you, like you couldn't actually, you know, there would be unlikely that you could even get enough studies to actually prove it enough to be used as a treatment. Just because, like, you know, there's not a big company backing it, you know, that is planning to make money from it, you know?
Yeah. We could do a whole podcast on how maddening that is. But your question was, you know, how does a practitioner start to get into this without coming off as woo-woo? And the answer to that is start reading. I love NCBI. I live in NCBI. There is so much good stuff in NCBI. So to give you an example, we'll just talk about gut health specifically. So, you know, 2,500 years ago, Hippocrates, this philosopher, said all illness starts in the gut. And now we have thousands of studies that show us that that's actually probably true. We have studies that show us that 95% of our serotonin is actually created in our GI tract. So, you know, instead of prescribing someone an SSRI that just helps their body reuse whatever serotonin they have, let's go figure out why their body isn't creating enough serotonin in the first place. And where does that start? That starts in their gut. And there are now studies that show that. That's not woo-woo. That's not pseudoscience. We have thousands of studies in NCBI that are peer-reviewed, that are excellent studies that show that. And then those studies they talk about, you know, gut dysbiosis and the microbiome and the mucosal lining of the gut and all of these things that you can help a client or a patient heal from. And you can use an SSRI as kind of a mitigation tool to help them get some bandwidth to change their diet, but you don't have to leave them on an SSRI forever. So that's an example. Things like sleep, you know, talking to a patient about sleep isn't necessarily sexy, right? Giving them a sleep drug, that feels sexy. That feels like, you know, oh, here's the thing that's going to fix your problem. But it doesn't actually fix your problem. And we now have, again, thousands of studies that show that sleep pills actually make people sleep worse. It takes them out of REM sleep. It takes them out of deep sleep. They might feel like they're sleeping, but all of those pieces of sleep that are so important to restore their body, those sleep pills remove their brain's ability to get into that, versus something like magnesium L-threonate is the only kind of magnesium that crosses the blood-brain barrier. And we now have, again, multiple studies that show that magnesium L-threonate combined with helping someone learn to get their phone out of their bedroom and get blue light out of their eyes for an hour before bed, combined with a mindfulness practice to help them calm that racing in their mind and get ready to sleep, combined with, you know, making sure that they're not exercising an hour before bed, combined with making sure that they're not eating an hour before bed. We do those things. And now all of a sudden we have completely fixed their sleep. And if we fix their sleep, now their body's able to heal all of these other things that we couldn't even touch before. And so what I think is really cool about that is that's not woo-woo. That is so deeply science-backed, and we have so much research and so many peer-reviewed studies. And, you know, no one's making $1 million off magnesium L-threonate, but it's solid. Find a good high-quality supplement company, help them get that, but then also, you know, help them with their lifestyle on these other pieces. And you have fixed a person in a way that you could never have helped them heal from that prescriptive model.